Hello everyone. So today's topic is very important regarding the head swellings in newborn. We have caput succedaneum, cephalhematoma, and subgaleal hemorrhage. So before going to each and discuss the clinical features, first concentrating on the scalp layer. So the layers of scalp itself, the mnemonic is scalp. Outside, say inside, you have S for skin, C for the connective tissues, A for the aponeurotic layer, that is Gallia aponeurotica, and below that there is a loose connective tissues or loose areolar tissues, and then below that, that is pericranium or periosteum. Okay, so depending on where the fluid or the blood is collecting, we have three kinds of swelling. So first we will be focusing on the caput succedaneum, which is the most common swelling that you get, and this is also having good prognosis. Here the fluid, remember it's a fluid or edematous fluid that is collected. In other two condition, the blood collected. So in this case, the fluid is collected into the subcutaneous plane. That's why it is superficial, and number two, it is diffuse because there is no restriction to the fluid movement. Okay. Number two, this caput succedaneum appears at the time of birth or just after the birth, and it disappears within 2 to 3 days. And number three, if you take histories like associated relevant histories, that will not be competent enough and that will not go with the caput succedaneum. It's just a normal finding that you get. Even in many cases, you might get these things. And why that is happening is because of the prolonged labor. Because of the prolonged labor, there is pressure over the scalp and there is basically congestion of the scalp veins and leading to edema. In the other way, the cephal hematoma, obviously there will be some associated histories like instrumental delivery or that any kind of trauma to the skull that led to fracture. Okay, and because of that the bleeding happens or that blood collected under the periosteum, that's why subperiosteal collection, and obviously below periosteum means it's a deep swelling. Number two, the periosteum is limited by sutures, so any collection below periosteum will also be limited by sutures. So when it is presented as a swelling outside, you can palpate it in the one side. I mean unilateral swelling will be there. It's not a diffuse swelling. Okay. So you can localize it because it is limited by sutures. Number two, it appears slowly, not like just as soon as at birth or soon after birth. It appears slowly over 24 hours and then it persists for 3 to 6 weeks. Now here is a clincher. As I told you, that's a bleeding. So there will be associated anemia in the patient. The baby might be having some fractures also, skull fractures, linear skull fractures can be there, and most often the baby may have jaundice because of this hemolysis that had happened, because of this heme breakdown and forming the bilirubin. These are caput succedaneum and cephalhematoma. Now coming to the third swelling, that is subgaleal hemorrhage, which is the most severe and having worst prognosis. This is a dangerous case where also the baby will be having superficial diffuse swelling, but that is blood. Now if I have to compare between cephalhematoma and subgaleal hemorrhage, दोनों में ही you have accumulation of blood. Now why this subgaleal hemorrhage is much more it's worse prognosis compared to cephalhematoma? Because in cephalhematoma the bleeding is restricted by suture, so it's a closed space. You can see obviously दोनों ही closed space है, but if you compare the space that is present in uh, subperiosteal में, the bleeding can be restricted by the sutures, but the subgaleal hemorrhage, this is wide space, so there's a diffuse bleeding happens and the bleeding will be enough to cause a hypovolemic shock or hemorrhagic shock. Indeed, these patients, these babies will be deteriorating over a period of few hours only if you do not resuscitate promptly. There also is this patient will present with severe pallor, severe circulatory volume loss, and jaundice. So, summarizing these three swelling and concluding the topic of today. So two kinds of swelling, superficial and deep. अगर deep है तो cephal hematoma and that will be limited by sutures. Okay, अगर superficial है so it is diffuse always. So superficial diffuse, if it is fluid and the vitals are normal, that appears just after birth and disappears within 2 to 3 days, is succedaneum. If it is superficial and diffuse but associated with severe circulatory collapse, the baby is deteriorating over a few hours, and that is subcalial hemorrhage. Thank you. And in the next audio sessions, we'll be talking about various neonatal reflexes over 5 to 7 minutes.